talk today about ear infections. So we call them otitis externa or otitis interna. Otitis externa is actually in the ear canal. Otitis interna is actually the middle ear infections. Those are the infections that we often end up at the doctor with our kids. That, oh, my kid has an earache. We're going to talk a little bit about the anatomy first. So you have the ear canal, and then you have the eardrum, and then you have the inside, which is the eustachian tube. Eustachian tube is a little tube that goes from the inside of the ear to the back of the throat. And so it's oftentimes will get infected, or sometimes it will swell up. You know, when you fly on an airplane and you have to kind of clear your ears, that's what you're doing, is putting air through that eustachian tube. Most ear infections are actually kind of secondary infections. They come when you have a cold, you've got a lot of congestion, and that congestion actually backs up through that eustachian tube and then starts to push and bulge on that eardrum, and that's what causes the pain. So one of the first things we do is we try and get that congestion to dry out with like a decongestant. So one thing that happens when we're kids is our eustachian tubes are more parallel like this. And so what's here in the nasal passages actually backs up pretty easily. As we get older and our faces elongate, those tubes go like this. And so that's why often we grow out of ear infections as we get older. Symptoms of ear infections are pain, fever. Sometimes we can't hear very well. Sometimes we even feel a little bit dizzy when we've got that going on. There are a few things that you can do at home that can help them. We prop up the bed so that the pressure of laying flat is improved. You can put a warm compress on the ear. You can use ibuprofen or acetaminophen, which is Tylenol. There's actually some really interesting studies about neuropathic drugs as well. There's a study that was done through American Academy of Pediatrics, and I'm going to put the link in the description, and it was with a topical relief where they had vitamin E and they had lavender. It was with olive oil, St. John's wort, and even garlic was in there. And we know that garlic and olive oil have a little bit of antibacterial properties. And so they had all of these kids, and they broke them up into 4 different groups. And one of the groups just had that topical combination in their ear. One group had that topical neuropathic combination with a numbing medicine. One had it with an antibiotic, an oral antibiotic, and one had an antibiotic with the numbing medicine. So 4 different groups. And they actually found that the group that did the best was the group that had the neuropathic only. And so they reassessed them after 3 days, and that was the winner. And so we do know that there could be some things that can help contribute to improvement. However, with any medical study, you have to look at it with a grain of salt. And so we do wonder was it just the body that was improving it, and that if we just wait 3 days, that the body will help get rid of it on its own. However, that being said, a topical neuropathic combination has very low risk. And so if you find something for your child that will help, it probably won't hurt and may even help. There's some interesting data as well from American Academy of Pediatrics that they prefer that clinicians actually wait to treat an ear infection, wait 2 or 3 days before they offer the parent an antibiotic. And that being said, I have kids. I've been up all night with my kids with ear infections, and in that case, I really could care less what the American Academy of Pediatrics says. I want my kid to be fixed. And so if you find that your child is hurting a lot, it's better for you to come in and get looked at. There are some complications if we don't treat ear infections, one of which is perforation. So that eustachian tube has all of that pus behind it, and it's building up, and it's painful, and it actually can break through the tympanic membrane, which is the eardrum. How you know is she'll start having blood or pus coming out of the ear, and the pain actually gets better. Most of the time, within 6 weeks, the body will patch that over and it will improve. But if it doesn't, we need to get you into an ear, nose, and throat provider and have that patch made. In that 6 weeks, if you do have a perforation, you shouldn't submerge your head, you shouldn't go swimming, and no hot tubs, and even when you take a shower, you should put some cotton in there so that no infection can get in there. We're going to do a quick tutorial on how you actually would look at an ear. So you need this piece of equipment here. It's called an otoscope. Remember, OT means ear, scope means picture. So we're going to get a look at the inner ear. And then you need something called an ear speculum, and these come in different sizes, one for little ones and one for adults. You twist it on and turn the light on because it's dark in there. When you look in an ear, you actually want to set the bevel right into the ear canal and lift the ear up and out. Everyone's ear canals are a little twisty and turny, but if you pull it up and out, you'll be able to get a really good look. So we can see the eardrum, which is called the tympanic membrane. Remember that the eardrum is level in the face of about the outer edge of the eye. It's actually called the outer canthus, and so you won't be able to hit the eardrum with the scope, but you should put it in so that you get a really good look. If you have any comments or tips that have worked for you or your kids, please put it in the comments below. Thanks for watching.